Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's webinar is part of our Nutrition During Cancer Treatment Education Series, a special collaboration between the Mass General Cancer Center and the Blum Center. Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it will be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has music and hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to complete. Your feedback is important to us as we plan future programs. All right, so next I'm going to turn it over to Rob Dunn, who will get us all started.
Awesome. Thank you, Amy. My name is Rob Dunn. I'm the Clinical Nutrition Manager at the Mass General Cancer Center. I am super excited to be starting this webinar series through the Blum Center. I think it's going to be a really nice opportunity for us to kind of showcase the ways that we can help keep patients nourished through the entirety of their cancer treatment. And I am very grateful today to be joined by one of the dietitians on our team, Martha Silva. Martha is a registered dietitian who joined the MGH Cancer Center in 2023. She completed her training before that at Brigham and Women's Hospital and has a passion for caring for patients at all levels of their cancer treatment journey. She sees patients in our centers in Boston, Danvers, as well as through the Lifestyle Medicine Virtual Clinic. Martha is going to lead the presentation today, and I'll be back on at the end to help moderate some questions. So without further ado, here is Martha.
Awesome. Thank you for the introduction, Rob. And I'll just share my screen. Give me one moment here to get the slides up. All right. Is that in presentation mode for you all?
Looks good.
Okay, fantastic. Good afternoon again, everyone. Today I'll discuss malnutrition awareness during cancer treatment. And I'd also like to quickly acknowledge my colleague Lola Horton, who helped put these slides together. Here's our agenda. First, we'll cover how nutrition fits into cancer care. Then we'll discuss the impact of malnutrition during cancer treatment, how to prevent and treat malnutrition, and as Rob noted, we'll save some time for questions and answers at the end. Nutrition during cancer care. Our team of oncology dietitians works with patients, their families, and their oncologists to manage the side effects of treatment, such as nausea, changes in taste, and painful swallowing, to develop individualized diet and hydration plans based on patient preferences and different dietary restrictions, to recommend oral nutrition supplements in order to help maintain weight, to prevent, identify, and treat malnutrition, our focus for today, to guide tube feeding support as needed, and finally to counsel on nutrition for wellness and survivorship, in part through the hospital's lifestyle medicine program, which focuses on the 6 pillars of lifestyle management: nutrition, exercise, sleep, social connections, stress management, and finally avoidance of risky substances. So what is malnutrition? In my experience, people may hear malnutrition and think of starvation from famine related to war or a natural disaster. That is one type of malnutrition, but it's distinct from the type of malnutrition that occurs in the context of cancer. Broadly, malnutrition arises when the body does not receive the right amount of certain nutrients, perhaps due to low calorie or protein intake, or when the body is unable to utilize those nutrients, perhaps because of a surgery or the location of a patient's tumor. In patients with cancer, dietitians are looking for specific information to identify malnutrition. And these characteristics include unintentional weight loss, loss of muscle mass or fat stores, and inadequate energy intake. These symptoms occur across a continuum that spans from moderate to severe, and other signs and symptoms can include fatigue and low energy, impaired immune function, poor wound healing, and loss of functional status, which practically might translate to an increased risk of falls or difficulty performing daily activities, such as carrying grocery bags inside the house, or even placing a pot of water on the stove to boil and prepare a meal. One of the reasons that we're so concerned about malnutrition is that it is incredibly common in people with cancer, impacting 40 to 80% of all patients over the course of their treatment. Additionally, over 50% of patients with solid tumors are malnourished at the time of their first treatment, and there are several factors that explain why these figures are so high. First, most cancers tend to speed up metabolism, so patients often find that they need to eat more than they did previously just to hold steady at their current weight. Cancer treatment may further increase metabolic demands, so it can be a bit of a 1-2 punch. And separately from the impact of treatment on metabolism, the side effects of treatment, such as nausea, painful swallowing, bowel issues, may lead to decreased food intake, and that can further compound weight loss. In addition to changes in metabolism and food intake, tumor location might interfere with swallowing, digestion, or absorption of nutrients. For example, an esophageal tumor may make swallowing solid foods difficult. Other tumors along various points of the GI tract might impact digestion or absorption of specific nutrients. So an example of this might be a pancreatic tumor that impacts the ability to digest dietary fat. And so these impacts will vary greatly based on cancer type. And finally, fatigue and busy treatment schedules may reduce the ability of patients to perform their regular activities, walking the dog, gardening, going to the gym, and this shift can exacerbate loss of muscle mass. Collectively, these factors decrease resilience, which we would usually define as the body's ability to bounce back from stress, which might be due to cancer, its treatment, or infection, to give a few examples. Malnutrition matters because it's associated with more frequent need for chemotherapy dose reduction, lower patient-reported quality of life, higher rates of infection, more frequent hospitalizations, higher post-operative mortality, and reduced overall survival. Knowing these potential and serious impacts, what can we as dietitians, patients, family members, and friends do to prevent and treat malnutrition? The cornerstone of prevention is symptom management. Our goal is really to address symptoms that might make eating or drinking difficult at the start. And these symptoms, again, will vary based on cancer type, treatment regimen, and even the individual patient. Some of the most common symptoms we encounter are listed here, and Rob and I will actually address how to manage these challenges specifically in future webinars offered through this series. Generally, our approach will involve some combination of medical management, like the use of antiemetics to quell nausea that the treatment team may prescribe, or medical nutrition therapy, which might look like a therapeutic diet or other specific intervention. Our patients all have different food allergies, intolerances, preferences, and chronic conditions that might require their own dietary modifications. So there truly is no one-size-fits-all approach here. But that said, these symptoms typically translate to low appetite. So what can we do to help? Typically, the first strategy that we'll suggest is shifting to a smaller, more frequent meal pattern. And this might look like aiming for anywhere from 4 to 8 mini meals daily. Ideally, each of these mini meals will have a protein source in order to preserve lean body mass, muscle mass. So for example, this might look like starting the day with eggs and toast, and then a few hours later, having some tuna salad, although this could also be chicken salad, hummus, whatever the individual enjoys, on crackers, then having a snack that's got peanut butter as a protein source in the afternoon, perhaps some soup in the evening, could be lentil soup or any other soup that the individual enjoys, and then another high calorie, high protein mini meal in the evening might be some Greek yogurt with blueberries. That could also be cottage cheese or even ice cream. And then when looking at those mini meals, the next thing we would typically recommend is to fortify them with calorie boosters. These are usually going to be dietary sources of fat that give you a lot of calories in a little volume, so it can just make eating a bit more approachable. That might look like adding half an avocado to those eggs, extra mayo to tuna, chicken, or egg salad, doubling up on servings of peanut butter that are paired with apples or toast, adding a tablespoon of olive oil to really any soup or broth. A tablespoon's going to have 120 calories, so it's a nice way to get some extra nutrition on board. And then, if tolerated, choosing full-fat dairy, that can add anywhere from 30 to 90 calories per serving, depending on the specific product. And adding in a variety of toppings to things like cereal, yogurt, oatmeal, that might be nuts, nut butter, seeds, dried fruit, granola, etc. For some, it may be easier to drink calories, particularly if appetite is quite low. And any of these options would be a great mini meal. On the grocery store shelf, that could be a drinkable yogurt or kefir, a different smoothie product, carnation instant breakfast. Many patients will make homemade smoothies and add protein powders, Greek yogurt, cottage cheese, or even smooth tofu to the mix. In the winter months, that might look like a high-calorie soup. And then in terms of oral nutrition supplements, there are a variety of different products. We're typically suggesting that our patient population opt for the high-calorie, high-protein versions of these shakes. So that might be an Ensure Plus or a Boost Plus compared to the Ensure Original, just because it's going to provide more calories in the same volume. There are Kate Farms products, Orgain products, a lot of excellent options out there. And if these milkier shakes are not well tolerated for any reason, many of these brands offer clear liquid products, and those typically come in fruit flavors and taste like juice, but offer more calories and protein compared to a standard juice. If these strategies geared at maintaining or increasing calorie intake don't move the needle, an appetite stimulant may be appropriate. These medications may take up to several weeks to have an effect, and results do vary. Some patients prefer to try cannabis therapeutics for appetite stimulation, and generally the addition of any new medications or integrative therapies would be done at the discretion of the oncologist, who can best assess the potential benefits and risks based on the patient's specific health picture. For some patients, nutrition support may be an option. First, tube feeds deliver liquid nutrition through a soft, flexible tube that either rests in the stomach or the small intestine. If it's not possible to safely use the patient's GI tract for delivery of nutrients, TPN, which stands for Total Parenteral Nutrition, involves the delivery of complete nutrition through a vein. And now I'm going to pass things over to Rob to discuss a few other interventions.
Awesome. Thank you, Martha. I think that you really nicely summarized the ways that we kind of combat some of those common symptoms. So thank you. I just want to talk briefly about exercise because I feel like often when we talk about nutrition in context of cancer, the kind of follow-up question to that is about physical activity and exercise. We know that one of the complications or one of the ways that malnutrition drives complications in patients with cancer is through a declining level of muscle health. Muscle health is a term that we use to describe both like the quantity of muscle that a patient has as well as the ability of that muscle to do certain types of work or like the strength that can be displayed through that muscle's activity. When muscle health declines during cancer treatment, patients are at higher risk of complications similar to malnutrition itself, higher rates of toxicity from treatment, more frequent need to have the treatment either dose reduced or paused, and that can lead to shorter overall survival. One of the ways to kind of moderate the amount of muscle loss that patients can experience during treatment is engaging in exercise or structured physical activity. So we'll just briefly discuss exercise over this next slide or two. Exercise is one of the key ingredients to maintaining muscle health, but only 18% of patients who are living with cancer actually meet the recommended level of exercise in a given week. You can go to the next slide, Martha. So what is the recommended level of exercise? The good news, I guess, is that the evidence we have so far doesn't say that patients with cancer need to exercise more than the general public to maintain their muscle health. So the recommendation is for 150 minutes, which is can sound like a lot. That's roughly 2.5 hours of moderate intensity aerobic activity. So that's a brisk walk, a swim, a hike, anything that's going to elevate your heart rate. And then twice per week, muscle strengthening activity or resistance exercise. So this can be yoga, Pilates, it could be walking while carrying light hand weights, it could be weight training, push-ups, anything that's going to engage your muscles to be stimulated to do work and then therefore afterwards grow. So no matter what type of exercise you enjoy or you've been exposed to, the kind of takeaway message is that movement matters. We want to move more than we sit, and continuing to create stimulus for our muscles to grow and to be healthy is important across the cancer continuum, both during treatment and then in cancer survivorship. Two resources for people looking to integrate exercise into their cancer treatment journey are listed on the right here. And then certainly as you engage with your care providers, asking about exercise, what exercise is safe, and resources to help you actually implement exercise in the community. You can ask your oncologist, and there are internal referrals to programs within the MGH Cancer Center that you may be able to have access to. All right, Martha, next slide. And then if for individualized guidance about nutrition across the cancer journey, we encourage you to ask your oncologist for a referral to our service. We see patients in Boston, Danvers, Waltham, and Newton Wellesley, as well as through telemedicine visits and, as we've said, through collaboration with the Lifestyle Medicine Clinic. So wherever you receive your care, our team is happy to meet with you. And then we can go to the next slide and open it up for questions. I want to thank you all for your attention today as we start our series. Okay, looking to the chat just for some questions, I can take the first one. And that's one that's kind of like a frequently asked question. And it's, should I worry about exercise burning too many calories? And for me, I would say that that's not necessarily a concern unless you're vigorously exercising for a prolonged period of time, multiple days per week, like several hours worth of exercise. You're not going to be burning enough calories that it's going to inhibit your ability to maintain your weight or maintain your nutrition. I'd much rather our patients be moving and able to stimulate their muscle health rather than feel like they're conserving energy by not moving. We know that movement is helpful, and I wouldn't worry about burning too many calories. Martha, maybe I'll pass the next question to you. One of the attendees asked, can you provide examples of plant-based protein-rich foods?
Sure, that's a fantastic question. So a few plant-based protein-rich foods would be, hummus, different beans, if you can tolerate them. Really, any type of bean would do. Lentils might look like tofu. Plant-based yogurts are a great option as well. There's a ton of different almond, coconut, and soy-based products out there. And then some of these protein shakes are fully plant-based. Kate Farms and Orgain have pea protein products. Owen is another plant-based shake. So there are a ton of different great options out there. And nut butters too, peanut butter, almond butter, lots of good options.
That's awesome. Thank you. I'll take this next one, and it's about exercise advice when dealing with neuropathy from chemotherapy or from other treatment modalities. That's a great question, and certainly something that's a little bit outside Martha and I's specific level of expertise. Certainly, if you're having symptoms that are making it you feel unsafe to be standing or that your balance is impaired, then talking with your doctor and maybe getting a referral to an exercise physiologist. The cancer rehabilitation program through Spalding is really excellent in helping patients kind of navigate cancer and treatment related changes to their mobility and then integrating exercise in a way that's safe. But even exercise that's done from a relatively low intensity, like chair yoga or seated work with like little hand dumbbells, might put a little bit less pressure on some of those sensitive areas, particularly like your feet. While still being able to stimulate your muscle health. Um, all right, let's see. One question again that I'm kind of pulling from a frequently asked question list is malnutrition reversible? Like once I've experienced weight loss during cancer treatment, is it possible to reverse that trend? And the answer I would say, and I'm interested in your feedback, Martha, is yes. Certainly, we see all the time that people experience short-term loss of weight associated with appetite changes or the start of treatment. And we are able to combat that through nutrition rehabilitation, emphasis on high calorie, high protein foods, and getting enough sleep and movement to kind of use that nutrition to recover. Would you add anything to that, Martha?
I totally agree. I would say the process of weight restoration after significant weight loss may be slow. So initially, our goal might be to just hold steady and maintain a patient's current weight. And it will certainly vary based on the patient population, but particularly for some patients who might end up on nutrition support, I think one of the big misconceptions that pops up regarding nutrition support is that it may be lifelong, and that certainly can be the case. But for some of our head and neck patients, for example, we may rely on tube feeding to restore their weight, reverse the malnutrition, and when they finish treatment, we may help them wean off of their tube feeds over time. So, one very specific example, but certainly for those folks, we do see them regain weight and restore some muscle mass.
Awesome. Thank you. Um, the last question I see in here is, are there any good web resources on nutrition tips and getting started with exercise? I would say that there are a bunch. I'm going to share some and maybe we can circulate it after the meeting. I'm going to say the one that I use probably the most regularly is the Fred Hutch Cook for Life recipe list. It's really excellent. It gives people access to recipes um, that can meet their dietary preferences. So plant-based, kosher, gluten-free, trying to integrate people's baseline dietary preferences while also achieving nutrition goals. So like high protein, softer diets, recipes that are helpful in managing nausea. So that's the one I probably use the most. And then for exercise, the American College of Sports Medicine has really great resources for kind of integrating exercise throughout your cancer journey. And then, of course, the Mass General Cancer Center's website. We're starting to build our portfolio of patient-facing education and kind of general tip sheets. Those are probably where I would tell people to turn first. I should say to not Google too much about food and nutrition in context of cancer without talking to your oncologist or a registered dietitian with expertise in oncology, because there's lots of good information on the internet, but there's far more misinformation and maybe kind of scary things that you can read online about food and cancer. And so our team is happy to kind of set those myths straight for you. Well, I'm not seeing any other new questions in the chat. Is there anything else on your end, Amy?
No, this was all great. I did want to update everyone that we did finalize the series. I'm going to drop in the chat the flyer of our series, and in the flyer will include the web links as well as QR codes to join our future sessions. So I hope to see you at our next session. And I think that's it. As I had mentioned, this session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. And I'll also enter our Blum Center email. So if you'd like a copy of that flyer that I just shared in the chat, as well as the Blum Center website, feel free to email us. It's pflc@partners.org. All right, everyone. Thank you so much for joining us.
Thank you.
Take care.